Catherine Vanderwoody.
And I'm Brittany Gailey.
We're going to give you some information today about diaphragmatic hernia. The objectives for our course today will be to understand what diaphragmatic hernia is and to be able to identify the symptoms. The nurse will identify the complications associated with the diaphragmatic hernia, and the nurse will understand the treatment for diaphragmatic hernias. Our agenda will be to explain what a diaphragmatic hernia is, to identify complications, and to identify treatments for this. So let's start off with what is diaphragmatic hernia. Diaphragmatic hernia, or DH, is the protrusion of abdominal contents into the thoracic cavity as a result of a deficit within the diaphragm. That is according to Speller and Gupta in 2020. About 1 in every 3,600 babies is born with a diaphragmatic hernia in the United States, according to the CDC in 2019.
Diaphragmatic hernia. Diaphragmatic hernias are usually diagnosed before the baby is born. Ultrasounds are used to diagnose this before birth. It is possible for doctors to miss this during ultrasounds, and it can be diagnosed after birth due to complication of the newborn. Once the baby is born, doctors may diagnose the condition after noticing the baby has trouble breathing. The chest X-ray can show that organs normally in the abdomen are in the chest, and the lungs look smaller than normal and are pushed to one side, according to the CDC 2019. Complications: diaphragmatic rupture, acute obstructive symptoms, respiratory failure, strangulation, and cardiac tamponade, according to Speller and Gupta 2020. Treatment: surgery is necessary to repair a diaphragmatic hernia soon after the baby is born. After surgery, the baby will need continued assistance to breathe until the lungs recover and expand, according to the CDC of 2019. Any questions? Thank you.
Thanks.
Yeah.